Hi everyone, welcome to researchmd.com. We got a great presentation today. Today's topic we're going to look at, is there evidence, is there an association between obstructive sleep apnea, snoring, and erectile dysfunction? My name is Pramil Cheriyath. I'm a program director in internal medicine residency program, transitional residency program, also teach medical students and residents at director of research. Okay, so let's get into our subject today. So we look at the epidemiology of erectile dysfunction. It's a huge problem all across the United States, staggering facts. If you look at the numbers, if you look at the men age greater than 20, almost like 20% of them suffer from erectile dysfunction. Okay, as we get older, apparently the incidence is higher in the older population. So what is the mechanism of erectile dysfunction? First, you got the arousal, then you got the parasympathetic signal go to the penis, nitric oxide release, and then GTP is converted to CGMB. CGMB causes like smooth muscle relaxation, and then you get erection. The way Viagra works is like that inhibit the CGMB conversion to 5-GMB. So there's more CGMBs available for the smooth muscle relaxation. That's the way the #1 drug in the world, Viagra, works also. So the risk factors of erectile dysfunctions are many, as you know. It can start from age, medical condition, tobacco smoking, obesity, certain medical treatment like prostate surgery, injuries, medications like antidepressant, beta blocker, psychological conditions like stress, anxiety, like depression, drugs and alcohol use, with a recreational drug also. Okay, so the next thing we have to do is we need to find out is there any studies out there? So we did this literature search and to find out which studies out there to look at, is there a link between this? Okay, there was a study published in the IJIR, International Journal of Impotence Research, and the title of the paper is Association Between Obstructive Sleep Apnea and Erectile Dysfunction, a systematic review and meta-analysis. And the objective of this question was, is there an association between obstructive sleep apnea and erectile dysfunction? Okay, in the design of the study, it's a systematic review meta-analysis. They got like higher evidence, so strong scientific support when you have a meta-analysis. And this is observational studies, okay? Remember that. So the results, they combined the odds ratio was 0.45 with a 95% confidence interval. 0.18 to 0.71. It indicates that patient without obstructive sleep apnea, their risk of erectile dysfunction is low. So overall, it means if you have obstructive sleep apnea, your risk of erectile dysfunction is high. Okay, so you have this nice graph over there showing our results. And in conclusion, based on this scientific study published, on the meta-analysis, we can clearly say that there is evidence supporting obstructive sleep apnea is associated with a higher risk of erectile dysfunction. So if you or your partner has been found to be snoring, it's a good idea to get evaluated for obstructive sleep apnea. So your sexual life is going to be better. Thank you so much for watching. We'll be back with another presentation soon. Thank you.